Hey guys, Ralph Havens here, Beyond Limits Physical Therapy in Bellingham, Washington. And today I'm going to show you a very simple technique to release what's called the posterior tibialis artery, vein, nerve, and tendon. It's real common to overuse this, and there's more that can be done to find the primary root cause. So just know that. Reach out to me if you need help, ralphhavens.com, 360-599-2217. Whether you're online or worldwide or here in Bellingham in Fairhaven. So here's the technique. And what you can do is walk around, test how you feel, walk around, see if you're having any issues, if you're having pain, especially in this part of your leg. This is good. This could be a useful thing. Again, we want to find the primary root cause, but this can help if that's where your pain is located. So what we can do, and excuse the pants, I should have had running stuff on, but I just talked to somebody and helped them out with this technique, and I want to really make sure I just get this out to the world. So on the side of the leg, right on the side, you're just going to put a few fingers, just right there, and you're just going to push the fingers that way. So right there, just a few fingers and just press. So maintain that pressure, and then the other, so I'm going to flip my hand around. So I'm on that spot, on the side, like that. Let me just get real clear so you can see. Right on the side of the leg, up high. And I'm going to press this way. And I'm going to take my hand and grab my heel, and I'm going to pull my heel away from the toes. So the heel goes away from the toes, and it's a few ounces of pressure. And then the fingers on the side of that lower leg, the upper part of the lower leg, are just going to press inward. And that's the technique. So what this does is it releases what's called the compartment syndrome. There's many compartments in the legs, in the body, and the compartments hold different things. They hold arteries and veins and nerves and tendons and muscles. And these compartments should glide on each other. And when they don't glide, they get a little stuck, and it can kind of impinge. It can tug on arteries or veins, nerves, it can tug on tendons. And so people show up with a little pain there behind the ankle bone, in the shin area. So you're having pain in the inner part of that lower leg. This may help. So again, I'm just touching that upper part of the upper part of the lower leg and just pressing it in. And I'm taking the ankle and pulling the ankle bone, the heel bone, it's called the calcaneus, pulling it away from the toes. And I'm going to hold it for a minute or 2 minutes. You can hold it for 3 minutes. And try this for yourself, and then get up and walk around and see what's different. Notice what's different. And you can do it on both legs. It's very safe to do. You can do it every day. You can do it a few times a week. You can do it just if you need a little help from time to time. This is going to be on a full blog post at ralphhavens.com. Just go to the blog, and I've got something for your shin and your Achilles and the plantar fascia, and this is for this posterior tibialis area of the lower leg. And if you need more help, reach out to me. We have a technique called myofascial mapping where I can put my hands on you and let you know what I see that's going on. And if you're worldwide, I can even see over Zoom and let you know what I see as the primary root cause of your condition. This is how I solved the problem that had been an 8-month calf spasm. I got a treatment from somebody in Los Angeles when I was first learning this many years ago, and she found the restriction was in my chest, around my heart, and that's what stopped my calf from spasming. So wherever your pain is, the cause might be somewhere else. All right, and then this is the right side. Again, we're going to the side of the leg, and I'm going to just take my fingers and I'm going to press inward. So just the tips of my fingers, I'm going to press inward. I'll use the other hand. I'm going to put my fingers right there and just press inward on the lower leg. So I'm pressing that way. And I'm going to take my hand and pull the ankle bone away from the toes. So just like this. And then just hold it for a minute, 2 minutes, 3 minutes. And it releases that posterior tibialis compartment. It has an artery, a nerve, a vein, a tendon, and it lets it slide a little bit. Now ideally we want to find the primary root cause, which might be farther up into the hip or the belly or the rib cage, but this can help loosen you up in that lower leg and the shin. And you can look at the other videos in this blog post and find things for the plantar fascia, more things for the shin, for the ankle. There's a secret of the talotibial joint, and a technique for the whole body for connective tissue releases. So look for that. And if you need more help, reach out to me, Ralph Havens at ralphhavens.com. And and the number is 360-599-2217. And let's get out there and run. Let's get you back on the trails and enjoying your life again. All right, you guys, I will talk to you soon.